And here in Middle Georgia, public health leaders are also working to get more vaccines to more people, no matter where they are. I talked with the South Central Health District about their efforts to inform more people about the vaccine and get better access to it.
Let's start off by talking about what are some of the vaccination efforts taking place right now in the South Central Health District.
When we started out doing vaccination clinics in our district, we were doing mass vaccination clinics. We have transitioned over time as we've seen the need and the desire for a vaccine decline and diminish in our area. And what we are now offering is the opportunity 5 days a week to go into a local health department, at least in our 10 counties, and get a vaccine at any time of the day, 5 days a week, Monday through Friday. In addition to that, we're offering really all three of the vaccines.
Are you running into any hindrances as you try to get the vaccine to more people?
I think that in our area, we do have some vaccine hesitancy. We have seen people who have come in recently to get vaccinated that were waiting. They were waiting to see how their friends did or how family members did when they received the vaccine. We do have some that, have said, I won't ever get the vaccine. And certainly that is a person's decision to make. It's a very personal decision. One thing that we have tried to let the community know is that it is a safe vaccine.
Vaccination efforts in the South Central Health District compared to Georgia statewide, what's the difference there?
One thing that we've seen across the center, the middle part of the state, is that our vaccine rates are a little bit lower than the rest of the state. One way that we're addressing that is going into some of our underserved communities that may not have access to transportation. We don't want any hindrances in anyone taking the vaccine. So if transportation is an issue, certainly we'll go to where they live and get the vaccine. So one thing we're doing is partnering with some of our public housing neighborhoods and going into those areas and vaccinating on site. We've even collaborated with CORE, who is offering vaccine in Georgia, and we've gone to parking lots of restaurants and vaccinated, offering the vaccine to those who are incarcerated, who can't come to one of our sites and get the vaccine, but we can go into those facilities and vaccinate. In the coming weeks, we'll be collaborating with the NAACP and some of our communities to offer the vaccine at Juneteenth events. And I think now what we're transitioning to is perhaps we're not vaccinating masses, but we're hitting, 3 or 4 or 5 people at an event, maybe even more. And our numbers may not increase dramatically, but they'll steadily increase over time. And so that's what we're looking at in our